Are you considering an MRI for your current injury and you're wondering, do I need it now? What will it tell me? And once I get the results, what do I need to be concerned about? That's what I'm covering inside this video. My name is Dr. Chris Garcia. I'm a leading expert in health and wellness and helping people recover from injuries so they can live their best life. Now, what is an MRI machine? It's a fancy machine that you go into that looks at a model of your back deeper than your skin, into your bones, all the way into your ligaments, past all of your muscles, and it gives you a good indication of if anything is broken, if anything is torn, if there's swelling. And most people don't get an MRI until a certain point in their healing process, especially if you're going through your insurance. You might go see your primary care, who might say, you know what, your body needs an x-ray. That comes out negative, so they give you a prescription for physical therapy, and then you have to show that you haven't had any improvement in that, and then maybe you get an MRI. Or you bypass all of that and you pay out of pocket for the MRI. Now, the next question is, why do we need an MRI and what does it tell you? Now, an MRI machine is very, very good to give you results for a specific injury, and all it does is it tells you if it's serious, you're probably going to need some form of surgery. If it's not serious, then you have to consider, do you want surgery? What type of outcome do you want out of the MRI? And for a lot of people, this leaves them stuck because best case scenario, you don't find anything on the MRI. Well, now you're lost thinking, well, if there's nothing on the MRI, meaning I don't have anything significant, well, what is the thing that's causing this pain? Now, worst case scenario is that you have to have surgery. Now, the question is, before you go the direction of getting an MRI, why do you want to get an MRI? And then what do those results tell you? And then what do you plan to do with them? So we went over an MRI and the basics on how this can help you with your healing. And the reality is, most people get an MRI because they want to know more about their chronic pain, their current condition, things that aren't getting better. And so you might have had an x-ray, you went to your primary care physician, they sent you for an x-ray, they sent you to physical therapy, you didn't have improvement. So now the next step is maybe you need an MRI. Some people go out of pocket or out of network and go straight to that. Now, whether you do all of those things, that's up to you. But you still have to understand, once you get those things done, what do you want to do with this and what will the results tell you? The results are going to tell you probably have some form of degeneration in your spine or your joints that are associated with age. Not just you. You can be 25 and have some of these things. You can be 65 and have none of these things. MRIs don't tell you everything about your case, so we have to be able to pull your MRI results with your current condition. If it shows that you have significant degenerative changes, there's nothing you really can do about that from a surgical perspective. So the next question is, what do you want to do with those results? Or your shoulder has been bugging you and you were concerned about an MRI result, and that MRI result showed a partial tear of your rotator cuff. And now you have to consider, well, what do you want to do with that? Do you want to have surgery or not? So the thing that we tell people before they go get an MRI, what is the thing that you want to know? And then once you get that decision, how will it change what you want to do with your course of care? A lot of people hang their hat on, well, I want to see what the MRI shows. Okay, great. Once the MRI shows you whatever it is, would you go surgery? Or would you go conservative? And most people would say, I just want to stay conservative. Okay, great. So the MRI result is not going to change your course of care. If you're seeing a physical therapist and maybe your results are a little slow and you're debating, well, maybe I need an MRI because something is serious in there. Okay, once you find that something serious, are you going to change your course of care? Are you going to stay in therapy or are you going to go to surgery? Most people just want to stay in therapy. So the question here is, the MRI doesn't change your course of care. All it tells you is maybe there's something there that has inflammation or partially torn. So then if you choose that route to not go surgery and you stay conservative, the only reason you get an MRI is for peace of mind, to know what it is. Now, that's fantastic. Maybe that gives you the certainty, gives you the confidence. You don't have to be super concerned. Now that's fantastic. But a lot of people who maybe aren't familiar with how this impacts the next decision, one of the best things you could do is ask yourself before you get the MRI, would I get surgery? And worst case scenario, if it doesn't show anything, what am I doing? You're probably staying the course of care. So if you're in the middle of physical therapy and you're debating, do I need an MRI? Think about it. Would it change anything? And if you don't want surgery, all this tells you is stay with physical therapy, but it gives you the peace of mind. So typically for most people who don't have significant changes or results or instability or inflammation, it just tells you to continue physical therapy. So what that helps you do is put less weight on the MRI. Just helps you understand, well, if I knew what the MRI shows, okay, I have inflammation and a partial tear. That's great. Now, all that tells you is what the forecast is. Maybe you have to be careful with this down the line. Maybe you have to be a little bit more conservative over the next 6 months so you don't injure it more. That tells you in forecast, but what it doesn't do is it doesn't push you to surgery automatically. It doesn't make anything dramatic. Now, a lot of people will say, well, maybe I can get an injection, maybe I can take medication. And the reality about that is most people are trying to avoid those things. They don't want injections, they don't want the medications. So if you're looking for that next step and you want an injection, maybe that might be for you. But all in reality, when you're looking at MRI results, what does it do? It gives you a picture, a better picture than an x-ray of what might be injured or inflamed. That's fantastic. The second part about this is, what does it do for your current course of care? You have to decide, are you going surgery or conservative? And the last one is, it just helps you forecast for down the line what you need to consider for the future of your health. So if you're considering an MRI, just remember those results can show you might have significant changes, you might have degenerative changes, but studies have shown that these results not just tell you how your body is, it's not just associated with your age, because they have seen degeneration and herniated discs, torn ligaments in people who are 25 years old and asymptomatic. They have shown that people in their 40s and 50s have these changes and have no symptoms, which means that MRIs will tell you what's injured, but not all injuries within your body correlate to symptoms. So if you're worried about your back and you feel like it's been bothering you and you see the results, don't be scared. You might see worse results than you thought. The reality is the doctor and your physical therapist are going to associate those with your symptoms, and we call them incidental findings, things that you didn't have any symptoms with, but they found. All those are great, but they don't tell you exactly what to do next. We have to be able to put those pictures together. So don't worry the next time you see these results. It is very normal to have some of these changes, even if people are older or younger and have no symptoms. So they'll put those together. So be careful when you interpret these. This will help you forecast, do I need MRI, what to do with them, and how does this help me? So if you are having trouble and you're considering what the next step is, or I have results, I'm not sure what to do, or you're still injured and you're wondering if the MRI, if you need that MRI or not, reach out to me and my team at Sports Performance Physical Therapy, and we'd be happy to get onto a call with you to help kind of walk you through, what those are, how to help you, and what the next steps are. And that's where most people are concerned, is that the certainty of what do I do next? And if that's you, we'd love to help. Start with a call and we'll point you in that direction, see if we can help you. If not, tell you who can help you with your current challenges. So until then, happy healing, and we'd be excited to be on a call with you to help point you in that next step. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on improving your lifelong health without aches and pains. Thanks, and I'll see you soon.